Good morning. Allow me to share Malaysian experience in managing COVID-19 pandemic. Malaysia is a good case study because it have done extremely well in managing the crisis in the first half of 2020, where by August the average number of deaths per million is only about 4. It's almost on par with the best country in managing the crisis, which is New Zealand. So we managed the crisis very well. The number of deaths is extremely low, at about 4, comparing to France at the time, I think about 450. In the UK, it's about 100. In US, 530. Malaysia was only registering 4 at that time. Number of cases by August also very low. It's about 9,300, when other countries is much higher in the millions. So Malaysia did extremely well in the beginning. The cases then very low, up to August about 50 cases per day. Few things that Malaysia did right in to get to that number, to get to that achievement. But since then, Malaysia did something not right that make the cases goes up, the number of cases goes up. By August, the number of total cases, the first cases were registered in Malaysia in February. By August, total number of cases in Malaysia was less than 10,000, about 9,300. But as of June 14, total number of cases has jumped to 685,000. It has increased tremendously. From 127 deaths in August, now the total death is about 4,300 deaths. So on a number of cases on per 1 million on a rolling 7 days cases, there are more cases in Malaysia, 3 times more cases in Malaysia than of India. There's 12 times more cases in Malaysia than of Indonesia. What went wrong? What did we do right to reduce number of deaths to only 4 per million, and compared with the best country in the world to one of not so good? I would share with you what did we do right so that other countries can learn, and we learn from each other. What do we do well? What do we do wrong? What do we do right? First, Malaysia prepared very early, because Malaysia had experience in managing SARS, managing H1N1, managing MERS from Saudi Arabia. So we have experience in handling viruses or pandemic or endemic. When the first outbreak happened in Wuhan in December, Malaysia started in December 2019. Malaysia already started Crisis Preparedness and Response Committee. It coordinated all public health officials and security team together in December. And how do we manage this? And among the things that it was implemented then, prepared then, was that first, we're going to purchase immediately the reagents, number 1. Number 2 is that we renovate hospitals, because we knew from Wuhan and from other experience from other pandemic, there will be influx of patients and there will be not enough ICU beds and hospital beds. So immediately we renovate hospital. We also dedicated certain government hospitals to purely COVID-19 cases, and those current ICU cases were transferred to other countries. So ICU beds were made ready and available. And dedicated hospitals for COVID has increased from 27 to until 40 hospitals. So we prepared even before first case were detected in Malaysia. Even the hospital, the daycare were renovated to hospital beds to prepare. This all in December. And first case were only detected in 25th January, when 3 Chinese tourists came to Malaysia from Singapore. We got it in January, and first death in 17 March. So even before all this happened, we already prepared. Government prepared much early. At the same time, Malaysia started contact tracing. In January, we tell Malaysians to avoid certain places in China, and when they come back to Malaysia, all were screened. Everybody that came back, not just from China, everybody was screened. Health screening started in all entry ports in Malaysia. And those who went to China were monitored and screened, and we followed them. We know who they were. Contact tracing started already. This before even first case. We were already prepared then. By February, we had less than 30 cases by then. In February, by end February, we immediately closed the border. No foreigners were allowed. There's 0 death yet. The cases less than 30, but borders were immediately closed to foreigners. Only Malaysians were allowed to come in, and all Malaysians that come in were monitored. We know who they are, where do they stay, and they have to report back to Malaysia. And by March, on March 11, when WHO announced COVID-19 as a pandemic, a week after Malaysia imposed total lockdown. And anybody that come to Malaysia at the time has to be quarantined 2 weeks at a hotel designated places. And automatically, Malaysia was total shutdown. Nothing opens, nobody leave the house, everybody stay at home. Only essential services were open, hospitals, electricity, supermarkets. All those only open. The rest are all total shutdown. And this shutdown started with 2 weeks, then it extended because the cases did not come down. By August, we reduced, beginning from March, from 100 cases per day on average to about 12 cases a day. Then we relaxed the lockdown. And a few things contributed to this. I mentioned earlier is preparedness matters. Second, containment and contact tracing. Government want people to come and to test. So tests at the government hospitals were completely free. Even when you admitted, it's completely free. So you shouldn't be scared to go and test it or admitted. It's completely free, both to Malaysian and to foreigners. You get tested free. Testing is free. Admission is free. And then to ensure contact tracing, government did an app, and everything is to here. Every places you go, you have to scan the QR code. So the system government knows where do you go, and easier for contact tracing. So the preparedness on containment and contact tracing helps. Preparedness helps, contact and containment helps. And the third factors is communication. Every day, Malaysians were being updated about COVID cases. 3 p.m. by Ministry of Defence and 5 p.m. by Ministry of Health. This is where we know that we have to wear masks, you have to avoid crowded places, this is the emergency going to happen, blah, blah, blah. So we knew. The fourth aspect is on the law enforcement. Malaysia, in general, follow rules. There's a survey done that 90% of Malaysians will wear masks, and now you see almost 100% wear masks. And if you break the law, you get fined. And when the cases go up, stricter penalty was imposed. You do not get fined. Immediately you go to jail. So we reduce the numbers. So the government prepared very well in managing the health. But at the same time, equally important that when they imposed the lockdown, to ensure that people stay home, the government introduced fiscal measures. Loan moratorium. So because if you cannot go out, you cannot earn income. So the government give you cash to stay at home to low-income people. To businesses, it subsidized wages. To the rest of Malaysians, automatic loan moratorium for 6 months. You don't pay anything for 6 months. But at the end of, let's say you take housing loan, it would extend it later on. But the first 6 months, then you do not pay anything. So you reduce your cost for you to stay home. Rental in government flats were waived for 6 months. Even electricity bill were given a discount between 2 to 50% to almost to everybody. So there's a fiscal measures to ensure that people stay at home, are not starving. At the same time, there's also monetary stimulus. Specifically, interest rate were reduced. Within 7 months, interest rate was reduced 4 times. So you reduce your costs. And for companies, you can go borrow from the banks for your working capital if you have issues at a 0 interest rate. So to ensure that health crisis is managed, economic stimulant must also be there. So Malaysia did extremely well, and the cases by the end of August almost come to 0. But in September, there's a political coup, on the states. In Malaysia, at the time we're not allowed to go out, to go across. Not many people are allowed to go across states, even interstate, inter-district are not allowed. But then because of the government, the federal government who is in power wanted to take over the state government which is under opposition, they allow election and they allow people to go and campaign and they allow people to come back to the peninsula, to other states without quarantine. And because of that, the number of cases spiked and we have not yet recovered since then. This is important lesson. During crisis, do not put political interests above human lives, and we have not recovered since then. It took us 100 days, 365 days to reach 500 deaths. Now it reached 500 deaths within 7 days. It's lost life. It's not just statistic, but somebody's parents, somebody's friends, somebody's kid. So political expediency failed Malaysia. At the same time, it's important to realize you have to protect everybody to ensure everybody is safe, not just your citizen. Malaysia started to treat foreign workers, migrants not so well. Catch them and put in detention center and the cases goes up. Singapore learned this very well to ensure everybody is safe. Citizen, non-citizen has to be protected. So we did not do well in that part. Because of political, we did not do well. We did not treat human being equally. And we vaccinate also quite slow. The rate of vaccination currently on a per capita basis, about 8 to 9% of Malaysians are vaccinated. This is very slow. You look at the poorer countries in the region, poorer than Malaysia, Cambodia and Laos is much higher rate because the bureaucracy in procuring and vaccinating people. So that slows down our progress or impede our progress. It's a lesson for other countries. But unlike the first round, the first half, which we did right, we did health, we managed health first, then you do economy. Now the government wanted to do both. You want to manage health, at the same time you want to open the economy. It doesn't work. You have to be in sequence. You address health, then you address economy. If you want people to stay at home to ensure cases goes down, you must help. And this time, when currently we also have a lockdown in June, but no more cash assistance. So if I'm self-employed, I would not stay home, because if I stay home, I have no cash. I cannot eat. I will go out. Ability for the government to inject is important. Now it's not the time to think of the debt level or rating agencies or fiscal condition. Now it's the time to ensure that people are safe, people stay at home. You can afford to borrow to ensure that money is in the hand of the people, so they stay home. Sequencing matters. Health, you get health right, you're going to get economy going. So that's basically what I want to share with you, what Malaysia did right and what Malaysia did not do so well in managing this crisis. Thank you.